Hey Doc, it's Nick. I just wanted to go over this case with a video tutorial. I think there's a couple things that we could learn here. This is your patient that came in with number 13/14 intermittent pain. Patient had a hard time describing what it might be. I think you also didn't necessarily see anything. Let's bring up her x-rays just so we can see if there's anything going on. Patient has a very low decay rate, so it'd be hard to surmise that she has some sort of biological problem with the tooth. But we do know these kinds of patients, patients with low caries risk, sometimes have a high biomechanical risk, so it's very likely that this tooth is fractured somehow, some way. I didn't see your testing. You came in and did a hygiene exam, so it's possible that you did all this and it just didn't get recorded. Something that we need to improve upon in the practice is endodontic testing during hygiene exams, making sure the data ends up in the notes. So I'm just going to assume that none of this was done. No harm, no foul. Let's all learn together and try to see if we can figure this out. So without endodontic testing, I'm trying to find other clues here. I don't see any widening of the PDLs, which might suggest, hyperfunction. Hyperfunction can cause hypersensitivity of the nerve. We know those sequelae that tend to happen. She doesn't strike me as the kind of patient that would have that for a variety of reasons. But we can see from the high degree of pulp stones that she has and just general wear that she's a parafunctional patient. We can see the black marks on the incisal edges of her lower anterior teeth. We know that is a form of entrapment, which is a destabilizing status for the mandible to be in. So we tend to see more grinding patients that have these signs and symptoms in the front of their mouth. Suffice it to say, she's got a higher biomechanical risk profile than somebody else. Why are we talking about this? Well, we want to evaluate whether or not there's a crack or a fracture. So upper right, I don't really see anything that speaks to fracture, but we can't necessarily rule that in or out. I'll just pretend that I did a tooth sleuth test and it was negative for cracked tooth syndrome or any sort of occlusal trauma. Let's just take that for what it's worth. I think I know the answer, and that's why I'm comfortable saying it's not one of those. But at some point, we're going to need to acquire the diagnostic data to support that perspective. Excuse me. So our friend, the CAT scan, often is very helpful in trying to figure out what's going on. So what I did, I created a slice right over the tooth, and then I zoomed in on the transverse or axial perspective of this tooth, and then I zoomed in. And just so you know, this is tooth 13. The patient isolates the pain to this area, which suggests it's more, diffuse pain tends to be more related to the surrounding periodontium or the bone or the tissues, and less so the A delta fibers inside of the tooth itself. Sharp, localized pain tends to be something inside the tooth. So we don't think it's a crack. We don't see any caries. We don't necessarily think it's irreversible pulpitis. We just see no reason for that to be the case. Yes, she has sharp cuspal inclines. These patients have much higher risk of having issues, but we just don't see anything. So looking at the CAT scan, I came across this. I always do the following. I'm looking at this image here, and I'm going back and forth. And what I'm doing is I'm looking at the bone. Excuse me. I'm looking at the buccal bone in this area. I don't want to say I do this every time, but it just jumped out at me, so it's something to keep in the back of your mind as you're doing your analyses on the CAT scan. But you can see how, for the most part, the buccal plate is very continuous, uniform, except for right there. All right. So if I assume that that is a discontinuation of the buccal plate because of a sinus tract, then I have to ask myself, well, is this a sinus tract? I have a hard time getting the exact slice where I can get the buccal bone fenestration and the sinus tract, but let's get the best image we can that captures all of it right there. Zoom in. And if I squint just right, I can definitely pretend that that's a sinus tract. Now, the patient didn't necessarily have any issues, but palpation of this area most likely would have resulted in some sort of indication that she has some inflammation going on. But I did find a couple slices where there's a very clear accessory canal that comes off right here. So let's go. Sorry about the crying baby. That's what happens when you have a house full of COVID-infected people. Alright, so I'm looking for something that gives me a sense that the portal of exit lines up with the fenestration. If I can't get something to line up, then I'm less confident about this diagnosis, but I can tell you I did see something which prompted me to do this video. Alright. There. See that little outcropping? That's very likely an accessory canal that is infected, and the body found its least path of resistance out the buccal plate. And that could explain the symptoms she's having. So, moral of the story is this patient might want more evaluation because of her overall bite. I started doing her treatment plan just to help you out, but I don't think she's looking for a full mouth rehab, although we could definitely work on some comprehensive solutions for her. She has a bolt discrepancy, all kinds of minor to moderate issues, but I think she wants this one issue resolved first. Let's get her back, do some endo testing, start with endo ice. If you don't have the NICAID algorithm for endodontic diagnostic testing, I encourage you to take a look at it and follow it down and see what answer you get from that analysis using some of the tools that we just went over now. But until we get a cold test, if it's negative, then an EPT test, and if it's negative, then we can come up with a strong conclusion that this tooth is necrotic, supports our diagnosis of pulpal necrosis with that would be acute apical periodontitis. Chronic presence of the sinus tract. Getting the right diagnosis is often difficult off the top of our heads. That's why I encourage you to take a look at the NICAID diagnostic endodontic worksheet so you can have the right data. Hopefully that helps you and your patient. I did see you referred the patient to endo. It's very possible that this tooth has already been treated, but I didn't see any post-op documentation from the endodontist, so I'm assuming the patient didn't go. I think this is something that we can handle. So hope this helps. Let me know if you need any help furthering the comprehensive treatment plan. All right, take care, bud.